Hello, my name is Dr. Kirmani. Welcome to my channel, Patient Knowledge. To my new subscribers and viewers, this channel is aimed at promoting health education. Every weekend, I bring new videos about the health conditions and I give an explanation about a specific health problem so that you can identify the risk factors and early symptoms of an illness. It's also encouraged that people should bring about lifestyle modifications to minimize the risk factors of diseases and lead a healthy life. And today I'm going to be talking about some of the warning signs of a heart attack. Well, did you know that your body starts to show signs 1 month before you get a heart attack? It's often ignored due to lack of knowledge or person getting too busy in day-to-day work and doesn't pay enough attention to these signs. Coronary artery disease is #1 cause of death globally. In UK, around 100,000 hospital admissions each year are due to heart attacks. That one every 5 minutes. And every year about 805,000 Americans have a heart attack. So let's get started and find out more about the warning signs of heart attack. Have you been having heartburn lately? Do you get nauseated? Have you got abdominal pain or indigestion? Do you get extremely exhausted even if you don't do too much hard work? Do you get dizziness? Have you been hearing your own heartbeat as if it's racing fast? Do you get shortness of breath? Have you got sleep problems? Have you noticed that you've been sweating excessively? And do you get any chest pain on doing some kind of activity which gets better when you take rest? These are all the signs that your body is trying to say something. These are the warning signs of a heart attack. So what to do if you have any of these? It's better to check with your doctor for a full assessment and follow the advice given by your doctor. In this video, I will be talking about what's a heart attack, symptoms in men and women which are different, what's a mini heart attack, silent heart attack, tell you what to do when you get a heart attack. We will explain what happens in the hospital and we'll give you some information about the prevention of a heart attack. At the end of the video, there's a list of food that are heart healthy, so stay till the end. Now, what's a heart attack? It's also called a myocardial infarction. Myocardium means heart muscle and infarction means death. Now, a heart attack occurs in people who have got coronary artery disease, and this is a condition where the heart muscle doesn't get enough blood and oxygen supply, which is cut off due to a clogging of the artery that supplies the blood and oxygen. It's a slow process and has developed over a period of years. Initially, people who have excess fat in their blood will develop a condition called atherosclerosis, where this fat gets deposited in the lining of the arteries. Gradually, it begins to narrow the flow of blood through these arteries and forms a blob of fat that's attached to the wall of the artery. And initially, when the blood supply to the heart is not adequate, the person may experience some symptoms of angina. Now, with time, the obstruction becomes more obvious and there is complete cutoff of the blood supply and oxygen supply to the heart muscle. That's when heart attack happens. Let's take a quiz about the risk factors of a heart attack. Now, here's a list of the risk factors, and if you go through that and find that you've got some of them or all of them, that means you are at a high risk of getting a heart attack in the future. Have you got a family history of heart attack? Have you got a stroke in the past? Do you have any pre-existing health conditions like high blood pressure, diabetes, angina, atherosclerosis, obesity? Do you lead a sedentary lifestyle, which means that you don't involve yourself in any physical activity other than your usual house chores or work at work? Or do you smoke? How many cigarettes in a day, and since how long have you been smoking? Do you drink? How many drinks in a day? And are you a social drinker or do you drink daily? Have you got high levels of bad cholesterol or LDL? So if you have all of them, again, you go back to your doctor and get yourself assessed. Here are the symptoms of heart attack. They're different in women and men. In women, the risk of heart attack increases after menopause because of lack of the female hormone estrogen, which is also cardioprotective. They may experience the atypical or unusual or non-classic symptoms of heart attack, which may be chest discomfort that may go up to the neck or jaw. They may experience extreme tiredness, get cold sweats, and heartburn. In men, there will be typical symptoms or classic symptoms where they experience pressure, aching, or tightness in the center of the chest. Many people complain that it is a feeling as if an elephant is sitting on the chest, and they have a fear of impending death. They may also experience pain or discomfort that radiates to the upper part of the body, especially in the shoulders or neck and arms, and sweat a lot. What's a mini heart attack? Chest pain or a feeling of pressure or squeezing in the center of the chest, where this discomfort lasting only for several minutes is called a mini heart attack. Now, this may come and go, and the pain may also be experienced in the throat. Symptoms may mimic indigestion or gastroesophageal reflux. Are you aware that there is something called silent heart attack? Well, it can happen in people who are elderly or those who have diabetes. It's important to know the signs of silent heart attack to get urgent medical attention by identifying them. People with silent heart attack may experience chest discomfort, pressure and fullness, discomfort in other areas of your body, difficulty breathing and dizziness, or they may get nausea and cold sweats. Now, when you've identified the risk factors and symptoms and you're not sure whether you're getting a heart attack, what to do? Never ever drive to the hospital on your own or with someone because you may need resuscitation on your way to the hospital. Call for help. And while waiting for the ambulance, take any medication that you are taking for angina. Paramedics will provide resuscitation in case you need it. Upon arrival, they will assess your situation, will liaise with the cardiac team in the hospital, make sure that your pain is taken care of by giving you morphine. They will transport you safely to the hospital in the minimum time. And what to expect in the hospital? When you arrive at the hospital, it will be treated as a medical emergency and the cardiac care team will look after you. They'll perform certain tests to make sure that it's a heart attack and will also visualize your heart internally. Some of the common tests done are ECG, blood tests. For serum cardiac markers, a chemical is released into the blood when the heart muscle is damaged, and most frequently done blood test is troponin. They may also do an echocardiogram, which is a painless test to check the heart muscle and heart valves, and will perform a radionuclide imaging to check area of poor blood flow in the heart. Now, once all the investigations are done, they will assess you for the type of treatment provided. Treatment of heart attack includes providing oxygen so that your breathing gets better and your heart muscle starts to get oxygen. They will give you morphine to take care of the pain and will consider giving you medication to dissolve the clot. After assessing your situation, they may suggest surgery, which will involve either putting a stent and ballooning or a bypass. After recovery from a heart attack, many patients are put in the cardiac rehabilitation unit. How to prevent a heart attack? And people who have already had a heart attack, they all are at a risk of getting another one. So here are some of the important things that one can adapt to prevent another heart attack. Just making simple lifestyle modification by eating healthy diet, doing exercises regularly. A 30-minute walk would be ideal. Maintain healthy weight through diet and exercise. People who are smoking need to consider quitting smoking. Those who have blood pressure, high blood pressure and diabetes, they need to control them through diet, exercise and medication and see their specialist regularly. Lower your bad cholesterol or LDL. And if you have stresses at work or at home, practice relaxation techniques such as yoga or meditation. Here's a list of heart-healthy foods: green leafy vegetables, berries, strawberries, blueberries, avocados, extra virgin olive oil, beans and pulses, nuts like almonds, and fish, which has omega-3 fatty acids. So include them in your diet if you have heart problems. That's all for today. I hope this information was useful in understanding everything about heart attack. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Don't forget to like and subscribe to my channel. Bye for now.